Morning. Okay, so we'll get started. Building a care team for CDKL5. If everybody could take their seats, please. Thank you.
Okay.
So Tristen is a really great partner at the Colorado Children's Hospital. She works with Dr. Tim Benke. She's the clinical care coordinator and really has been a great foundation at Children's, working with our patient community, and initially started with the Rett syndrome community to help our patient community use the Colorado Children's Hospital facilities and really approach CDKL5. You know, CDKL5 isn't just one issue. CDKL5 is multiple issues affecting our children. So thank you, Tristen, for being here today, and thank you for all your work with the community. You're an excellent inspiration for all of us. Thank you.
Thank you. So we're going to definitely be a change of pace about what you've been listening to so far this morning. So we're not talking about research. This is not anything as in-depth as what you guys have been going through this morning. So just take a deep breath. No more research for a little bit, okay? Deal? Deal? We're going to be a little more interactive, a little more okay. Deal? So I'm the nurse at the clinic here at Denver, and we're just going to talk a little bit who you want on your team. This is a really broad subject about who you want on your team. I have no disclosures. I know everyone's had a bunch of things they get money for. I'm totally open for money if anyone wants to throw that my way. Yeah, real open for that. So who's in here? I know everyone, like half the room left. We're cool with that. We're going to be real intimate now. Hey. So who's left in the room here between 0 and 5 years old? All right. And 6 to 15? Okay. And 16 to 20? All right. And then over 20? Yeah. Anywhere over 20? I know we have more here. They were looking for more over 20. If you want to meet them, I will show them to you later if you want to. They were looking for more older ladies. So find me later if you want to find them, because they were looking for more families on the older side. Just while I was thinking. And how many of you have been to a CDKL5 Center of Excellence? Anywhere? Okay, great. So that's where I'm coming from. That's not all I'm going to talk about. So don't think I'm just going to preach on, like, you need to go to a Center of Excellence. Don't think that's where I'm coming from. So don't just mentally be like, oh, I'm just going to check out, because that's not all I'm up here to talk about today, because it's so much more than that who is on your team, as you know. So let's just start. Where does your team start? Which is at home, with you guys. With you. You guys. I'm sure when I got up here, you guys expected that the first thing I would talk about is that you need a bunch of doctors on your team, but you guys are their world. The first person that needs to be on their team is you. And that is the first person you need to be taking care of. And I put on your oxygen mask first, because the most things that I get the phone calls from is from parents that are tired and exhausted and just tired from doing the day-to-day stuff. And let's be real, it's hard. You're the ones getting up at night. You're the ones driving to all the appointments. You're the ones giving up jobs to take care of them. You're the ones working extra jobs to take care of them. You're the one giving up a cool car to drive a handicap van. You're the one giving up fun things to go to therapies and appointments. You're the ones that give up everything because they're worth it, and as all your children are. But you have to take care of you, and you need to take care of you by investing time in you. And that's just what I wanted to remind you of today, is a little bit of that, because you are their world. And if you're not taking care of you, then you can't take care of them. So much lately I've been seeing parents that are so tired, and I just wanted to remind you of that if you're not taking care of you, you can't take good care of them. The other thing is taking care of your relationships with your friends and with other people in your life. Part of that is just the fact that these are your people. These are the people in your life that are there for you in the storm, there for you after the storm. These are the people you call when things are going hard. These are the things when things are going well. And these are the people that you want to keep investing in those relationships. Go to the movies, go out for drinks, go out for coffee, go out for whatever you need to do. But just, I'm up here to pep talk. So I'm not up here to just keep throwing research at you. There's no research on, there probably is research on how good that is for you. Let's be real. But let's just remember that how important that is, because it is. It's so good for you to be investing in those relationships in your life because they feed back into you and let you feed into your child. Let me figure out how to scroll down on this thing. I use a Mac. So, and take care of your marriages. If you're married or if you're dating or whatever, take care of those. Go on dates. Let people let you go on dates. Let groups in the community let you do those things because, again, those are the things that are going to get you through your life. Those marriages are the things that are going to get you through. You need to pull together in these times. As you know, having a child with disabilities is so hard on your marriage, and you need to pull together and get through. And just coming into our clinic, I can see that on families, and you know it, and families will say it. And just, we've started putting that into our program, that when families come in, we're like, how are you doing? How is your marriage? And families are like, and it's just something we want to remind families that it is so important to keep doing that and going on dates and putting effort into that. And then into your other children, I had a family just this weekend tell me about Hope Kids. It's just something that is in different communities. She just told me that it's here in Denver. And it's a group that I guess works with different organizations, different businesses to allow families to go out and do things together, go out on dates, go out with their families, and do stuff for free. So she was telling me that they've been able to go and do Topgolf together for free with their family. They've been able to go ice skating, go do roller skating, and do stuff together, and they actually have it here in Denver. So I was like, I need to start telling my families this, but just get on their website, see if they have it in your community, just see if there's other things that you can do together as families to go roller skating, do ice skating, do stuff like that together, whether it's all as a family with your child. There are times that they will open up stuff that you can get a wheelchair out there on an ice rink, on a roller skating, doing stuff like that together as a family, and letting your other children see that, oh yeah, we can do this all together, and that my sibling can do this, and that's okay. And just remembering, and I think that she was saying that it was fun that her other child could see that there was other siblings doing that, and that was really fun for her kid to see. So she was really enjoying that with the Hope Kids. So the other thing is counseling. I think a lot of families have been telling me that it's been really good for them to be doing personal counseling, marriage counseling. After, I know there's some families here with loss, and that, grief counseling, group counseling, kids counseling, there's play therapy. There's lots of things for your kids that are siblings to be doing play therapy that can work out and talk through what is it like to have a sibling with a disability and work through that process. I think there's a lot of options, and that there's things we can be doing to help those siblings work through this and process that. So it's just an idea and something to process and go through. Vacations, take them. I just had a patient the other day come in, and their child was 20 or 30, and it was the first vacation they had ever taken ever. And broke my heart because they used coming to our clinic as a reason to take a vacation, which was amazing because they extended their week, which is great. If you're going to come to a center of excellence and you've never been out of town, use that week to vacation. That's wonderful. But take them. There's places. There's Maddie's place that I think just opened in Texas. There's places that you can go and vacation together, and whatever that looks like. There's things to do. There's places to go. They're going to look different, and that's okay. Are you going to be able to vacation like everyone else? Maybe not, but that's okay. Is it always going to maybe be 2 weeks in Europe traveling and backpacking? Maybe not. Or maybe you can strap them on. You can do what you need to do. But maybe maybe it looks different, and that's okay. But do what you need to do as a family to bond. They don't need to be in a bubble, and you need to go live and do what you need to do. We had a family that was just like, I don't know, and I was like, go live. Let your family go experience things together, and bond and live together. And I have a wonderful friend, Christy and Evelyn here, and I just wanted to show you. This is them skiing. You can do this. They have adaptive skiing, and you're able to do this kind of stuff. And they strap them in, and this is her and her daughter here with CDKL5 skiing here in Colorado. So there's options, and I just want you to keep that in mind, that there's people, like, if you're not the person that's able to do this, because obviously Christy has experience skiing, so she can be that mama that does that. I personally have no experience skiing, so I would not be that person. But there are people that would do that for you, and you could just be the person taking pictures and being like, yay, that's my kid. But there's options, and just if you want your kid to experience that and have a once-in-a-lifetime kind of experience, do it. Take the pictures, do it. There's water stuff you can do. There's all kinds of stuff like that you can do, and I just want to experience and take the help. Let people help you. Don't just say yes. If they're like, oh, if you don't want to, I know, and maybe I'm saying this even for myself just as much as I am for you as a mom, I know it's really hard to accept help when it's being given to you, because I know I don't do it myself nearly as much as I should. But allow people to help you. Even when you think, no, I've already accepted enough help, people help me all the time, take more. Take more help, because you are exhausted and you need it. And your child needs it, and you need the breaks. So allow people to let you go and do fun stuff and do whatever you need. So just constantly say yes. More skiing. So home. I've been hearing a lot lately of, coffee, sweet nectar. So I'll get to social media in a second, but home is home, and this is their epicenter. This is where they are happiest. This is where they love being. Home is wherever your child resides. This can be your house, this can be someone else's house, this can be a care center, and this is wherever that might be. And there is no judging here. There is no judging in clinic, and I think just keeping an open mind wherever that might be, whether that's talking with other families, whether that's on social media, and just remembering that everyone has to make their own decision for that, and whatever's okay. And that there's no right place for anyone. That everyone needs to make their own decision when it comes to this at the right time. I think that if you need permission for us to help guide you, if you are like, we just can't take care of our kid at this level anymore, and you need us to say it's okay to take the next step, that they need to go get more medical care somewhere else, and you need us to give you that permission at a clinic or anywhere, we'll give that to you, and we'll say it's okay. And I think that's okay. I think that, and I think that the community needs to be more accepting of families. I think that some of the families have had a hard time on social media with saying, well, we would do that, but everyone else is a little more judging of us on social media of that. And I think it's been hard for them to say, well, we can't physically do it anymore. And I think it's been really hard for them to make that choice. And I just want everyone to just step back for a moment and remember that everyone has to make their own hard choices, and it's going to be really hard for them, but everyone just needs to remember that everyone has to make their own choice when it comes to that. And it's got to be right for them and their family. No. And then making your child's room personalized. I've had a lot of families lately talking about the different ways they do their kids' room. We have one family who's made their kids' room totally into almost a hospital room, just because that's what their kid needed. And then that was for them. And then there's other people that, because they had nurses in there so much, gave them their master suite and needed that extra bathroom in there. I mean, I think everyone needs something different for their child, depending on their medical needs. And just remembering that you can make their room whatever you need, and sometimes Medicaid will pay for that. There's grants. There's all kinds of things that'll help you pay for those things to make your room. I mean, they'll help you put in they'll help you put in air conditioning, they'll help you put in oxygen. Like, there's a lot of things that will help you pay for stuff to put into your home to make it more unique for your child. And just remembering that you can make they'll also, if you live in an apartment, they'll help make sure you get a first floor, and that kind of stuff. There are charities that'll help make them handicap accessible. They'll help put in ramps, there's waivers. I think that just remembering that there's a lot of groups out there that'll help make your home more what you need. And I think we've had a lot of families realizing that with even doing construction to their home, there was a lot of grants out there that could help with constructing their homes. So my husband's a firefighter, and he wanted to make sure I told you this. So he wanted me to tell you to make sure to put good numbers on the outsides of your home, because if you're calling for emergency care to your home for any reason, if you don't have good numbers on the outside of your home, it's really hard to find your house. That sounds silly, but when they're trying to find you at night or even during the day, if the numbers on your house aren't easy to see, it's hard to find. Albeit if they're coming to your house a lot, which some people, they do, they know your house and they eventually know your child really well. But when you move and when you get, sometimes it's just something to keep in mind to really identify your house really well. And he was like, people need to know this. It's really important to make sure their house is identified. And so I told you, I could tell, but I told you, that's that. I've gotten this question a lot lately, and I realize it is a weird question and something that when you're new to the community, I know a lot of you are all new and some are new. And so I needed to kind of talk to everyone to this, but it is something unique. And how do you hire people into your home? It's not something you're innately born into to know this. And it's something that, what do I ask them when I interview them? And it's a weird thing to have to do, because you want to bring someone in that becomes a part of your family and your home, but you also want to keep it professional. And so it's a very unique relationship that you form with these people that you hire to become your nurses, your aides. And so it's kind of a unique sort of questions you want to ask. Part of it's just down and dirty. Like, you want to know, what are you going to do? What am I going to do? But you want to make a list. You want to know, what is the nurse or the aide going to do? What are they physically going to do? And what are you going to do? So you want to know, like, what am I going to be responsible for? What are you going to be responsible for? So that it's not this weird, what's the mom going to do? What are you going to do? But also, what is reasonable to ask of them? Like, should I ask you to give her a bath? Should I do the bath? Is it okay if I ask you to give the bath? Of course, you should give the meds, but is it okay if I give the meds too? Like, those are the kind of weird things. So it's okay to ask all of those questions and make it very clear that, I would prefer if you did this before you left, or make sure that you change your diaper before you leave, or all of that is okay to have exactly written out, but I would make sure that you exactly have it written out. And specifically ask for all of it, because that's okay as the parent and as, technically an employer of this person. And again, a friendship is okay too. But technically, you're still bringing this person into your home, and it's okay to have requirements and to have both sides. But to ask kind of this whole list of questions. And there's a difference between a state agency or a private agency. We've had families who, there's a state agency or Medicaid's paying for someone, but then they also hire someone privately to do a little bit of side stuff that the state isn't doing. And you can sometimes get a little bit more out of that person, and that's okay too. And keeping a record, how do we keep a record? Do we want them to write everything down? Do we want it to keep it pretty broad? And there's little things. Do you want them to stay awake all night, or is it okay if they doze off a little bit? I mean, it's okay to ask these things, and it's not weird to ask those things of this person when you're employing them. I think these are totally reasonable things, and oh goodness, and completely legit. And then in Colorado, at least, I know not every state does this, but we do pay for parents to act as a CNA or a medical assistant for their children. So looking into that for your state, so they get paid to do the things they're already doing for their child, which is an amazing thing, I know, and jealousy ensue, I know, but a lot of the parents do get paid just to do what they're already doing for their kid, which is an amazing added benefit of living here. And just looking for grants. Some are out there and able to help pay for different things and able to help. As you guys know, you're rock stars at looking for a lot of that stuff. But just keep Googling. There's always new grants. There's always new stuff. There's always new things to keep looking for. And don't quit looking for extra money to help you, because it's just always popping up. Okay, primary care. So this is the other epic center of care once you move from your home front out. Don't you love my little drawing I made? So, delightful. So, if you think of your child as this little smiley face, that's your kid. So, your kid is the little smiley face here, and I like to think of your PCP as that red circle there. And your child should be at the center, and your PCP should really surround you and should be that person that, if you see the little arrows, I like to consider that all of the extra people you see. That's the therapist, that's your neurologist, that's your eye doctor, that's your GI doctor. That is literally everyone else. And all of those people should be pouring back into your PCP. They should all be sending their notes back to that PCP. And when I say PCP, this is your primary care doctor. This is that doctor that does the sick care. I'll explain what all they do in a second. But this is that person that is the center of your care. And I'll explain a little bit more in a second. But they should be the person that is getting all the notes on your child's care so that they know everything about your kid. They will help disseminate this information. They'll hold on to everything. They should have every note and know everything that's going on with your kid. And if they don't, find a new one. I'm not kidding. They should know everything. They should be the center. They should know everything. And adult primary care. I know. This is hard. Moving out into that world, there's not a lot of great adult primary carers who deal with people with disabilities. And if you have a magical unicorn one that does do that, A, share it with me, and B, we're working on building that up. At least in Colorado, I'm really working on that, especially for my patients, so that as my aging CDKL5 population grows up, I have a better network for that. And I know that I'm sure your areas are doing that too. But it's a harder world out there, and so we're really working on that. And I know that Judy is going to talk a lot about that in the transition to adult care, because we are really working on building that, because it is just a hard world to transition up. But I think they're really working on trying to train these providers out there. We're really trying to work on educating providers out there. And I'm going to talk a little bit here about what do you want in a primary care doctor. First off, I'm going to point out the obvious. On this list of what you want in a primary care doctor, there's no CDKL5 up here, because I'm going to be real. Most of them do not know what CDKL5 deficiency disorder is. And I'm going to be real, you're going to have to teach most of them. So let's just put that in our heads, and that's okay. There's going to be some that know, but you're still probably going to have to still teach them and guide them, and that's okay. Just know that that's okay, and guide them, and lead them to your neurologist, lead them to the centers of excellence, and we're there for that. But here's what you want, okay? You want someone teachable. You want someone that is willing to say, you know what, I don't totally know, but I am willing to learn. And that is A-okay. You want that. You want an accessible office. You want someone that you can call and email and is like, yep, you can get a hold of me. Because that's what I want in my kid's primary care doctor. You want a good front desk. I don't know about you guys, but there is a big difference. Anyone? Yeah, right? There's a big difference in an office you can't reach. And when you can reach your kid's office, it's a big difference. You want an online system or some way to get a hold of them, because trying to reach them or besides just calling is really helpful. Being able to write it out, being able to get a hold of them is really helpful as well. And do they connect to your local hospital? At least with us, it's really helpful when our records connect with our local pediatricians so that we can see when you visit them, that we can see all those visits. And that's a great question to ask when you're checking out new pediatricians or new doctors. Because when we have a pediatrician out in the community and we can see all your visits, we can really see all the care you're getting, and it's really helpful. It's just a great question to ask. It's not, I put it 5 because it's not necessary, but it is really helpful. And it's just something to ask again. When do you go? I know this sounds silly, but when you have a kid that has a lot of issues, sometimes you end up calling your neurologist for a cold, and it's not totally relevant. So just a reminder, when they're sick, go to that pediatrician. Let's make them that center of care. Let's let them do that stuff. Let's go there when they're sick. Let's go for those yearly health visits. So that's going for the yearly visit every year when they turn 1, 2, 3, 4, 5, 6, 7. Those visits, you got to go every year. Let's go for, I'll show you for the annual visits, that kind of stuff. As they age into the adulthood, let's go for the yearly visits as well. They need to get their cholesterol checked. Again, they're getting into adulthood. They need to be getting adult stuff checked. They need to be doing cancer checks, breast exams. Again, as we age, we're still at risk for aging stuff. We're still at risk for cancer and breast cancer, and we need PAP stuff. I mean, there's still things that, as you age, we're still at risk for. I had a patient in the other day, and I was like, okay, well, when you do your breast exam, Mom, you should do her breast exam. This is a 30-year-old patient. And she was like, oh, well, I don't really do that stuff. And I was like, well, we really should be doing that. Moms with boys, you can really ignore this, but, well, actually, boys can get breast cancer. You can check them too. But anyway, it's just something to remember that as they age, there really is still risks of that. And just because they have one thing doesn't mean they're not at risk for another thing. So just something to keep in your head, that this isn't something that isn't possible, not to scare, just to remind. And why are you going to these visits? And again, centers of excellence are good for these checks too, but you're not going to them every year or every 6 months to get checked. And these are those things that you need to be getting checked because of CDKL5 deficiency disorder. We need to be getting the bone health checked, calcium, and part of this is because with a child in a wheelchair, we need to be checking calcium and this kind of stuff. When you're up walking, your bones are really healthy, but when you're sitting in a wheelchair, your bones just aren't getting that strength that the muscle is building with them. Spine health, again, we've talked about, you've seen the scoliosis is a possibility, so we need to be getting a spine exam once we get it a little bit older into the teenhood, getting x-rays if we start to get a curve and that kind of stuff, checking for scoliosis. Vitamin D, again, checking these kind of things every year as we get older, and checking our heart health, getting an EKG, looking for, right now in CDKL5, we're still looking for a prolonged QT. This is something that we've seen with Rett syndrome. We're still watching with CDKL5 deficiency disorder. It's something that we've carried over with them being similar. Research we're still looking into to see if how much we see it and how long we'll carry those things over into our things. Consulting team. I'm going to show you our team at our hospital for ours. We have a ginormous team, to put it lightly. I'm going to show you all our faces because they're pretty. But I'll go over all the specialties here. But our neurologist, me, epileptologist, our rehab. You've seen a lot of these faces actually talking this week so far, or this weekend. You saw Katie already. You've seen Tim and Scott and Dr. Stratton, and I think you can probably read all these. I don't need to give them all to you, but we have a great team. I know, this is excessive, right? We have a really great team. It's huge. There's 20 of us. And when you come to our clinic, you literally see everyone. It's a really long day. Well, not that long. It's 5 hours. But this last team is hit or miss if you see all of these people as well. But let me kind of go through here. So neurologist and epileptologist you're seeing for reasons you know of, rehab medicine for movement, developmental pediatrician, and our behavioral psychologist, you're seeing behavior, you're seeing for sleep, ortho, you're seeing for spine, cardiologist for heart, palm for breathing, and sleep and breathe and BiPAP and all kind of good stuff like that. GI, you've heard all the good reasons at the talk the other day. Geneticist and genetic counselor, you're seeing for counseling, and PT, OT, ST. Social worker is just helping with resources. Gynecologist is consulting. She's helping with management of and she's already talked to you earlier this week, or this weekend. Palliative care does see all of our patients now, and I'll talk in a few seconds. Dentist, ophthalmologist, again, dietitian, again, seeing all our patients in other places as well. Palliative care, I mentioned, everyone probably takes a quick breath, like, "Ooh, why are they seeing my why are they seeing my kid? What's going on with that?" There's a difference between palliative care and hospice, and I just wanted to bring that up because hospice is end-of-life care, and I think there's a difference in that, and just reminding everyone of that. So we do have all of our patients starting to see palliative care, and that's just because palliative care is putting someone on your team because it's looking for the whole self. It's someone on your team that is looking out for what does your child need and what are the goals for your child. And they're saying, okay, what are the goals for your child? What do you want for your child? What do you want to happen for your child? What are your absolute desires for them? What do you want to see happen? And most of them are like, I just want them happy. I want to see them do this, this, and this. And they're like, okay, great. And then what do you want to do if they don't have that happen? And the parents are like, okay. And then we come up with a plan, and that's that. And then we just have a plan, and it's just an emergency plan before we even need to use it. And then we tuck it in the chart, and they just come up with a whole person plan for our family. And they're like, what are your coping styles? How are you dealing with having CDKL5 disorder? What is that like? What's that like for your family? How are your children dealing with that? And that's our discussions. And so it's just a whole person outlook for the family. It's not hospice. It's not end-of-life care or anything like that. We have hospice available when our families need that. And it's a great thing to have when we need that. And it's great that our team knows them when they need that. So it's not a first meeting when it's the end. So it's not that scary when it's that time. But so know that if your team introduces that, it's not for that reason. If they say palliative care, it's not hospice, it's not end of life. So know that that's the difference in that, and that's why we have that on our list. Therapy. I think we've talked about it. You're going to talk more about therapy. I think there's a therapy session every 3 sessions here, so know that that's why. When you get to the end of your life, how many hours do you actually think you've logged with your child in therapy? Like thousands, millions? It's a lot. And there's a short list here of the types, but if you attended Dr. Stratton's talk the other day, there was a huge list of all the kinds. And I'm sure you've heard them all, you've seen them all. There's tons. And I know that I'm not saying, you've done them all, you've seen them all. And I think my favorite part about Dr. Stratton's talk the other day was the fact that she just kept mentioning how they need to be, that she kept saying, well, these ones are just fun. These are fun. And I think that it's a great reminder that these are kids. And sometimes you just need to do some therapy because it's fun. And even if it's not gaining skills or whatever, you just need to do some because it makes your kids smile and because it makes them happy. And you just need to take a break from the hard ones sometimes and do some because it's fun. And just remember that sometimes that's okay to take a little break and do some because it's fun and because your kid is a kid. And so remember, and a big thing is to remember that also as your child ages is how important it is to do it for a life. I think that's something that Medicare wants to drop it off. And we will write letters until we are blue in our face to keep it going for life. And I was just telling someone I will do it. Ooh. Oh, you don't see this on your side. There's some update on this computer popped up. And I don't know how to work a PC. I'm an Apple girl. But anyway, thank you. But they wanted a bike, and I wrote 10 letters to Medicaid to get them a bike. Thank you. Because I will do what it takes if a family wants something, because it's so important to get that kind of stuff. And in the end, Medicaid still wouldn't pay for a bike, but then I got some other organization to help pay for a bike because, it's so important. And I think that that is why having a good pediatrician or a center of excellence on your team is so important, because they will keep fighting for you. They will fight and fight and fight and fight and fight, or a therapist or whatever. Your team is your team is your team, and just keep fighting for you. So aging. So I think I talked a little bit about before, but remembering to watch for normal things of aging, continue with the therapies, keep moving. If they slow down at all for any reason, call your team to keep them moving. Even a young child, if for some reason they stop moving for any reason, something's not hurting, something's whatever, they're not sitting, they're not crawling, they're not whatever like they should be, call your team. They should keep moving. That is just one of our biggest important things, that whatever type of movement they were doing before, if they stop doing that, let your team know. Because any type of movement, slowing or stopping, is just so detrimental, and we just want to keep them moving. Whatever they're doing, we want to keep it going because it's just so helpful for them and healthy. It keeps everything going. And just with the aging population, I think the biggest thing we've seen in our clinic with our 20s, 30s, 40s, 50s is any changes are just so hard on them. And so just, any changes in their routine, in their housing, any of that kind of stuff is really hard on them. They love their routine, and as with myself included. And so just remembering that and knowing that if for some reason they get really sad or stop eating or any of that kind of stuff, it's probably because something in their routine changed. And just watching that and realizing that, and that maybe they're a little sad. We've seen that a lot lately, and parents are like, oh, you know what, we changed this, or she got her teeth pulled and now she can't eat. And, oh, we took away her food and she really loved eating. And we were like, yeah, now she's sad. And they didn't realize that. And for some reason that really changed her whole everything. And so there's just a lot of things that can really change everything for them, and just remembering that, and that they do get sad, and that addressing that kind of stuff is a big deal. And just preparing as your kid is aging into the teens, is preparing for that, preparing for guardianship, preparing for your aging, preparing for, I think there's people addressing that this weekend, but just the guardianship stuff, the preparing for your estate, their estate, that kind of stuff. So, final thoughts is just never saying never. And remembering that when reading things online, when seeing how people are doing other things, is just being kind. On social media, I know it's easy to be like, well, I would never do that. I would never do that for my child, or I would never treat my kid with that, or you should never do that. And I think that's been really hard for a lot of parents to hear or feel when trying to make decisions for their kids. And I've had to tell a lot of them, just step back from social media, get off of it when making hard choices for their kids, because they feel a little judged, like, well, someone's going to say I'm giving up on my kid. And I said, no, you're fighting for your kid, and it's okay to do this. It's okay to do this for your family, and just get off social media then if you feel that people would be judging you. And I feel like that's not the best choice. And just looking around here, like, everyone just kind of stop and look around for 1 second. Can everyone just look around for 1 minute? So this is your team. Like, this is your team. These are your people. These are the people that you get on, that you care for. These are the people that support you. These are the people that you text when things are hard. These are the people that would support you when things are fun, when things are hard, when you're making tough decisions. And just remembering that this is your team, and just having grace with each other, and remembering that, like, no two kids are exactly alike, no matter even if their diagnosis is the same, and that no one's exactly the same, and that you can't make the exact same choices for each other. And so just having kindness and care for each other. And just really thank you. We are so honored to care for your children. I'm thankful to have my job, because I just love getting to care for your kids, love on them, see them, just be any part of what I get to do. And so just thank you for all you do, and for supporting IFCR and everything you do. So, and thanks for letting me come talk and coming to my talk. And letting me be your cheerleader today, because that's just all I was doing. I was going to throw up a picture of, like, me in my cheerleading uniform back in the day, but I thought it'd be a little weird, so I didn't. Any questions?
Jim, we definitely need more of you.
Pep talks. I figured I'd just put brass or something today, but I figured we had enough of those.
We hope to have somebody like Tristen at every center of excellence. So we'll take questions.
Good.
Okay. If you think of anything, Simone.
Keep you on time.
My son doesn't have one, but he does aspirate and has a lot of aspiration pneumonia. Should I be pushing for him to see a pulmonologist?
Yep. That's an easy answer. Yep. Fight hard. You're a good fighter, though. You look like you can duke it out. I know. It's so hard.
A couple of things. My son sees a pulmonologist.
Dr. Binky has a
Question? We had another question? Okay. Tim?
Mm-hmm. We will. Mm-hmm. Use the centers of excellence, you said. We will write letters
So
for you.
use the centers of excellence. I can write a letter to your primary care physician and say, in our experience with our patients with CDKL5, it's typical when a child is having a lot of aspiration pneumonias to consider referral to, fill in the blank specialists for X, Y, and Z reasons. And it's not difficult for us to do. We do this. It gets to a point where it's almost a form letter, but I think we can help you. I'm not sure it will help in the end, but we can try to help you to see if that gets you what you need. But then it creates a point of contact with your physician, with us, so they can say back, well, why does he really need this? And we can tell them why, and this is how it will improve their care overall. So really use this. Yeah. It's because Tristen helps me.
Email me. I have cards out there on the table on the children's, and I'll send you a pre-written letter. I have them for everyone if you want to. We have them all written of why CDKL5 needs it. And because I send them out so much for so many patients. So it's so evident why it's needed. So I write a lot of letters. I'm a professional letter writer. It's fine.
You guys talk about standards of care, but when I talk about standards of care in Australia, they just go, oh, that's ridiculous. That's what they do in America. And we don't do standards of care. So what do you say to that?
Standards of care and translating that across oceans. Yeah. Oh, sorry. Yeah.
Hello. My friend is coming from Peru, and she has a child there. She's asking if the doctors or the pediatrician can contact somebody in the U.S. from the Center of Excellence and to ask questions about the treatments they have.
Yeah, we've done that for quite a few patients. We have interpreters available, and we can do that. We've seen one patient from Canada fly to see us, and so we can work it out. It's just a little difficult sometimes getting all the pay stuff figured out to come see us physically, but definitely calling and consulting and talking through stuff is definitely an option. Do you have another question?
Sí, yo escribía a todos los centros de excelencia haciendo la consulta de Valentina y solo me respondieron de uno y efectivamente me dijeron de que la financiación, eso era lo complicado, ¿no? Pero ninguno más me respondió. No sé si hay alguna persona en particular.
She has written to many centers of excellence, and just one got her back. And again, they told her about the cost, and it was just so expensive. And if there is one that everybody kind of gets to a person where she should write or contact somebody. I don't know, she wrote her many letters, that's what she's saying, and she just got back from one, and maybe she just didn't send the email to the right one, probably.
I think you emailed me, but it was all in Spanish, and I didn't know how to reply back. Maybe. I didn't know how to say, but I don't have interpreting but if you call, I can, I don't know how to email it back in Spanish, though. Okay, yeah.
And I'll just let everybody know that so from anywhere around the world, whether you have a patient advocacy group in your country or not, emailing the IFCR through our website, right? We have contact us information. We will know that that is something to be, email us directly through the website. If you can just say help, that will let us know that, you know, help, I'm a parent, and put the rest in whatever language you want. That will make it happen. Okay? So anyone from any part of the world, feel free to email through the IFCR. Just give us two letters. Help, I'm a parent, and that's it. We'll take care of the rest. We'll get you an answer, and we'll get you to the right place. We'll get you help. What other questions? Okay, so we hope to have about 6 centers of excellence made public on the website very soon. You've heard New York, which will be a new one, and we hope to be able to clone Tristen in lots of ways. So I appreciate your attention today. We are here for you. Our centers of excellence are here for you. Your local care teams are critical, though, but if we can help you to build your local care teams and use us for that guidance, that is what we're here for as well. So let us know if you need anything. Colorado Children's has a table outside, as well as all the other centers who are present at the conference. Okay? So we've got a break. Take it back here at 10:15. We've got another session going on in Aurora 6 as well. And we're looking forward to the rest of the morning with you. So thank you.